Now let us study the axillary nerve. You know the axillary nerve is a branch of posterior cord of brachial plexus which arises in the axilla. It is seen posterior to the axillary artery and lateral to the radial nerve. And then it will go through the quadrangular space to reach the shoulder region. That much we have seen. Now let us see the further course and branches of axillary nerve. So that is the humerus, cut section of humerus. And this is the deltoid muscle which covers the humerus anteriorly, posteriorly and laterally. Now medial and anterior to the humerus, here is the axillary artery. So in relation to the axillary artery, axillary nerve will be seen posterolaterally. Now this is the triceps, long head of triceps. So this space will be between the triceps and the humerus, surgical neck of humerus will be the quadrangular space. So the axillary nerve will go to the shoulder area through the quadrangular space. Then within the quadrangular space, it divides into two divisions, anterior and a posterior division. Okay, before it reaches the quadrangular space, its first branch is given off, and that is the articular branch. It supplies the shoulder joint. And now let us see the two divisions. The anterior division winds around the humerus along with the posterior circumflex humeral vessels, and then it supplies the deltoid muscle and pierces the muscle to supply the skin over the deltoid. Now the posterior branch has three branches. Posterior division has three branches. First it gives off a branch to teres minor muscle. Now see here there is a dilatation here, thickening. That is the pseudoganglion. Pseudoganglion, what is ganglion? Ganglion is a collection of neurons. But pseudoganglion is a thickening in the nerve which may resemble a ganglion but doesn't contain any neurons. But it is just a connective tissue thickening seen in the nerve. So it is a pseudoganglion. So nerve to teres minor from the axillary nerve bears a pseudoganglion. Then it supplies the deltoid muscle, posterior part of the deltoid muscle. After supplying deltoid, the posterior division forms a cutaneous nerve which is known as upper lateral cutaneous nerve. So the upper lateral cutaneous nerve will also supply the skin over the deltoid muscle. So now you can see the axillary nerve obeys Hilton's law, which states that the nerve which supplies a joint will supply the muscle acting on it and the skin covering it. So what is the functional importance? During abduction, when the skin of the axillary floor is stretched, this will stimulate the axillary nerve and in turn will inhibit the deltoid muscle. So thus it will prevent over abduction and dislocation of the shoulder joint. That is the functional importance of axillary nerve obeying Hilton's law. Clear? Now let us see the clinical importance or applied anatomy of axillary nerve. Axillary nerve can be injured in different ways. First, it can be injured in dislocation of the shoulder joint. It can be injured during inadvertent intramuscular injections. Then it can be injured in hypertrophy of the muscles forming quadrangular space. And also it can be injured when the shaft of the surgical neck of humerus is fractured. So in all these, when the axillary nerve is injured, what will happen? Of course, the deltoid will be paralyzed and skin over the deltoid will show anesthesia. And teres minor will also be paralyzed, but it is a very small muscle with a minimal rotation action only. So it doesn't signify. Now let us see the clinical features of axillary nerve injury. See here, this part of the skin has lost its sensations because it is supplied by the axillary nerve. So, such an anesthesia is known as regimental barge anesthesia because this is the region where barge, a military barge is. So, it is called regimental barge anesthesia. Now, other clinical features are you can see the abduction will be lost due to the paralysis of deltoid. In addition to that, you can see the rounded counter of the shoulder. Here, you can see the shoulder is rounded, whereas here the rounded contour is lost due to the paralysis and wasting of the deltoid muscle. So, the rounded contour of the shoulder is lost and abduction will be defective. It will be lost in axillary nerve injuries. So, these are the clinical features by which you can identify an axillary nerve injury.